Welcome back. Skin cancer is the most common form of cancer in the United States. It's a form of cancer that impacts all ages, sexes, and races. Dr. Sarah Smith is a dermatologist with StantonMD who deals with skin cancer and other changes on a daily basis. Skin cancer is incredibly common, and like most cancer, the earlier it is recognized and addressed, the more likely you are to have a full recovery.
When a dermatologist finds a melanoma incidentally, or another doctor finds a melanoma incidentally on exam, it's more likely that that melanoma will be thin and easily treatable than if we wait until the patient notices a problem and then goes in. Those melanomas tend to be thicker. There are groups that definitely do need to be screened regularly, so that includes people who have had a melanoma, people who have a first-degree relative, so that's parents, siblings, and children, first-degree relative with a melanoma, people who have had other types of skin cancer, because if they've had enough to get one kind of skin cancer, they've definitely had enough sun to get another skin cancer like a melanoma. And then redheads, and it's not just because redheads are more likely to burn, that's part of it, but really redheads have a genetic mutation to have that pretty red hair that puts them at much higher risk of actually developing a melanoma because their DNA cannot be repaired from ultraviolet radiation as well as someone else's can. And then people with a lot of moles. So if you have somebody that has over 100 moles, that person's going to be at higher risk too. So those are all people that I would say it's very important that they come in at least yearly and get checked. The older you get, the more likely you are to have skin cancer because you've been here longer and you've gotten more sun exposure. People think it's really just sun exposure in childhood that's the problem. That's a common misconception, but really what you do in your 60s still matters. So wearing sunscreen as a child is very important, but wearing sunscreen as an adult matters too.
When a patient comes into Dr. Smith's office, she has some criteria she uses to help identify problem skin lesions.
What I'm looking for, we talk about the A, B, C, D, E's. So asymmetry, irregular border, uneven color, diameter larger than a pencil eraser, and then the E is really the most important one, I think, and that's evolution, a mole that's changing, and that would be something that you would tell me on history.
She also looks in key body hotspots based on sex and race.
In men, the most common site among Caucasian men is going to be the back, which is hard for you to actually look at, but it's a great place where a spouse or someone you live with can actually check your back and look at your moles. For women, the leg is actually very common. Now, some sites people don't think about, part of where I come in is checking places like your scalp. You can't see your scalp. So I actually, when I do a skin check, I look through all of your hair to make sure that there's not a melanoma on the scalp, because although sun exposure is the leading risk factor for developing melanoma other than genetics, you can get them in places that are not sun exposed, and I think that's really a surprise to people when they come in, that it's not just the places where you've had sunburns that we need to look. It's really everywhere. And for non-Caucasians, so for African Americans, people of Hispanic descent, and then also Asians, we have to worry more about atypical sites like the soles of the feet and the palms of the hands, and also the genitals. So that is a very uncommon site for melanoma generally, because most melanomas occur in light-skinned people, but in pigmented people, that's going to actually be more common than for you to have a mole on your back. That would be actually a melanoma.
The key is a thorough exam that scans every common and less common site a cancer may hide.
So I usually start all my skin checks once I've taken a history to find out if there are any moles or spots that the person's concerned with. I start at the top and work my way down. So I always check someone's head, and I usually encourage my patients who've had a melanoma, not just for me to check it, but every time they go to have their hair cut, for their hairstylist to check their scalp too, because I only see them either every 6 months or once a year, and the hairstylist will probably see them once a month or every couple of months, and so can really help pick up on something if it would be there earlier rather than later.
Ideally, you don't want to have a dermatologist on speed dial. This is accomplished through prevention. There are many things you can do to prevent skin cancer, and several mistakes Dr. Smith sees that may put you at greater risk.
Wearing sunscreen is good, and I think people sometimes get misled by SPF. They look at SPF 100 and they think, oh, I'm good, I'll go out and wear this and I'm doing what I need to do. And what people don't realize is that a lot of times they're not blocking UVA, they're only blocking UVB. So you got to be sure you have a broad spectrum sunscreen. And also a lot of the really high SPFs are chemical sunscreens, and they actually degrade in the sunlight very quickly. And so they don't remain active for as long as people think they do. So you really do have to reapply. Of course, staying out of the sun during the peak hours is important, but what I do and what my family does is we actually use sun protective clothing and hats, and I have found that to be a huge benefit over just doing sunscreen. The other big thing that I really counsel people about a lot is not going to the tanning bed. I don't think people understand just how bad the tanning bed is. I think they think that it's kind of bad, but not as bad as smoking, but actually you're more likely to get skin cancer from going to the tanning bed than you are to get lung cancer from smoking. And so you should not go to the tanning bed ever for any reason. And the idea that you're going to use the tanning bed as a way to not burn on vacation and that's somehow a healthier behavior has been completely debunked. A tan is a sign of damaged skin. We don't use sunscreen to make it so that we can lay out longer. That's actually a dangerous behavior as well. You know, people who are really fair-skinned, it used to be that they would get a sunburn and they would realize they needed to go in and they would get out of the sun. And now, because they can prevent the burning, they stay out longer and expose themselves longer to those ultraviolet A rays that we think are important in not only skin cancer, but also in skin aging.
Dr. Smith also reminds us that skin protection is a year-round venture, not just in the summer months, especially if you participate in winter outdoor sports. More StantonMD is coming up, so stay with us.